And we are live.
Hello, good evening, everyone, and welcome from Fortis Healthcare. This is something that we were looking forward to, and must be hearing a lot about Omicron, the new COVID on the block, and we are in the process of completing 2 years of this pandemic, 2020, 21, and the next year is coming. So there's a lot of concern amongst the Indian population on where are we, what are will be its implications, how do we take care of livelihoods, our education for our children, our parents. So keeping that in mind, we have a elite panel who will discuss and share their thoughts on this. Not that we have all the answers, because this is just in the making. If you look at it over the last 2 weeks, this thing came up, and we have some new insights to it, but more to follow. But it will be appropriate for us to take the insights, their expert opinion from our panelists. We have with us Dr. Anup Mishra, Dr. Rahul Pandit, and Dr. Shushmita Roy Chaudhary. In a turn by turn, we'll be asking them, and whatever your questions are, please put it up, and we'll at the end of the session. And if you have any specific question to any of the specific panelists, we'll definitely take it forward one by one. So I'll start with Dr. Anup Mishra is the opening batsman. So since his letter starts with A, so that's the reason I'm starting with A. So would like to ask you, sir, that in comparison to the first and second waves, Delta was the second wave, which was the most brutal. If we could look at it from the Indian perspective and across the globe also, how does the threat of Omicron affect India? So, what is your opinion on this?
So first of all, sir, thank you for including me in the panel, and I thank Fortis Healthcare for arranging this very important meeting. So the threat is very real. Now there are two parts of your question, sir. One is there a threat or not, and the second thing is, as you very rightly described, the brutal second wave, whether this will be brutal or not. So the number one answer is that the threat is very real. And number two answer, I'll just try to describe a little bit here. Um, we are now 2 years down the line as far as the epidemic is concerned, and we are approximately 1 year down the line after having received the first vaccinations. Some people may be 9 months, some people may be 6 months. Uh, and our children are not yet vaccinated. And so there are three category of patients. One is general patients. Number two, those who are elderly and immunocompromised. And three, who are children. So I will describe the threat as you describe, whether it is going to be brutal or it is going to be mild or what, in these three categories of people. So one, as far as general population is concerned, again, I will say vaccinated and unvaccinated. So those who have been vaccinated for, say, 8 to 9 months or so, they're fairly protected, I must say, against any COVID variant. Um, but some of us, I mean, I'm one of them, the immunity may be waning. And so today, I may be less protected than what I was 4 months back. So that is one reality. So we are facing a threat against a new variant, and some of us who have been vaccinated may have this if it comes to us, but our immunity is still there to fight it. So it may not be as brutal as it was in the second wave for those who are vaccinated. As far as unvaccinated is concerned, any threat is real, or any threat can be brutal. Um, as far as elderly and immunocompromised is concerned, threat is very real, and is good if they are infected by any variant. There could be consequences which are not good. And as far as children are concerned, as we go along in the discussion, we'll tell you about this variant, whether it infects the children. So, just to summarize my answer, the threat is very real, but since good amount of people are vaccinated, the severity may be less, and we'll talk about severity by this variant later on. But in some population subsets, like immunocompromised, like organ transplantation, like children, the threat continues, and some may have severe disease amongst those.
Thank you, Dr. Anubhav. In fact, that's very reassuring to for people to hear about it. And on the vaccination thing, again, a takeoff from that, I'll come to Dr. Rahul Pandit on this. With more than nearly 50% of our population now being fully vaccinated, in other words, the two doses, and nearly about 70% having one dose. What is the there's a lot of apprehension in the public minds, with medical, non-medical, everyone, on the status vis-a-vis the Omicron that is now lurking. It has already struck us in India, but not to the extent that is there in other countries. So, what is your uptake on this, Dr. Rahul?
Good afternoon, everyone. Thank you very much, sir, for organizing this webinar. So my take on the vaccination is very clear, and I think we need to keep it absolutely simple. So the first and foremost, like Mishra sir said, vaccines work. We need to get that doubt out of our minds that though vaccines don't work. That's the first thing. So vaccines work. All vaccines, whether it's the Indian ones, which is the vector-based vaccines, the Covishield as well as Covaxin, and maybe the mRNA ones, or the other vaccines which are available across the world, all vaccines have shown to decrease the severity of the disease. That's what the vaccines are meant to do. You don't get into hospital, you don't die because of the disease, and you don't get a severe disease. That's the main important thing to remember. There would be still 2% of the people who may get the disease, but that disease will be mild or asymptomatic. So that's also very clear in scientists and in clinical status. As far as our country is concerned, I think there are two or three more aspects to just consider more than just 50% vaccination. Most of our sero surveys, which were done across the country, as well as individual cities and states did their own sero surveys, all of them showed that immediately after the Delta wave, majority of the population, up to 80% of the people, had antibodies in them. So there is some immunity concept which is called as a hybrid immunity. That hybrid immunity is present in the country at a reasonably larger extent than anywhere else in the world which has been reported. So hybrid means a large amount of population got COVID and then they have developed antibodies against it. On top of that, we've done a substantial number of people who have been vaccinated with first dose, almost 85%, and 50% approximately with the second dose as well. So we've got a strong hybrid immunity in the adult population. I think we should be reassured about that. Now comes the question, I think, about the pediatric population and the other population which we did not talk clearly about. We might talk about that during the course of our talk. I think even in that age group, we had a reasonable amount of sero survey positivity which was seen. So I think those are the two things which we need to remember. And then we will, of course, come up to booster doses and other things which could be whether to start the pediatric vaccination or not. I think the apprehension among people should not be there. This is a very clear thought process in that. And if they use mask and they vaccinate themselves well, the disease will not bother any one of us. I think we need to be socially responsible to adhere to COVID appropriate behaviors and to vaccinate ourselves.
Thank you, Dr. Rahul. In fact, it's too early to say, but I think so. India is in a sweet spot with that hybrid immunity that you're talking about. So hopefully that will be good for India. Let's see how things pan out. Coming to our next panelist, Dr. Shushmita Roy Chaudhary from Kolkata. Ma'am, is there any concern about the susceptibility of the different age groups? Because this is another thing that the public has been questioning, whether it's in the print media, the electronic media. When you talk with when you go back home, our neighbors, they ask us, especially when we are doctors, they keep asking us, and this discussion does happen. So, is there an age group that is more susceptible to this?
Thank you, Dr. Panigrahi. So, yes, not just Omicron, not just COVID, with any kind of viral infection, we know that extremes of age group, if they get infected, their severity is usually more than the others. And therefore, it is very important that we protect these age groups even more. So, as Dr. Pandit said, that COVID appropriate behavior needs to be even stronger during this period than it was before, especially because the children have now started going to school. As the amount of precautions that were taken in the first and second wave, that is gradually, COVID fatigue has come in, and children need to go out, children need to play. But then most of them are not with masks, most of them are not having social distancing. And in that case, if you are infected with a virus that is more transmissible than the other variants, then the chances of them catching an infection, thankfully, from the experience in South Africa and in the other places where this infection is happening, we know that the severity is lesser. But these same children can take the infection home, and the chances of reinfection in elderly people is going to be higher. So therefore, the virus causes more damage in elderly people, there is, or in younger people, there is no evidence to it just now. But keeping logic in mind that any kind of viral infection, and especially COVID, can affect extremes of age group with more severity, the only thing that is in our hand is to prevent it, and to continue to mask up properly, and continue to have COVID appropriate behavior, at least for slightly longer time to come.
Thank you. There's a very important advice to the public is that please don't drop your guard. So no age group is actually sort of is protected. So for heaven's sake, let us not drop our guard. Now coming to the next one is about the transmissibility of this virus. Is that there's a lot of concern that is it more transmissible than the Delta variant or the earlier variant. So, Dr. Anup, what are your initial thoughts on this? Is there anything that the public can be educated on?
You're
Early days.
absolutely right, sir. These are what my thoughts are based on somebody else's experience, and these are initial thoughts. So these are not final thoughts. And whatever experience of South African physicians and public health specialists are, that it seems to be infecting faster than the previous Delta or any other variant. And the waves pattern which they have shown shows almost a vertical wave with this variant. So it's a whatever it is doing very, very fast. And some people say 3 times faster, some people say 5 times faster. But another very preliminary sort of a data which has appeared from Hong Kong is that people who are quarantined in one hotel, and they're separated by rooms, and they have not gone out of their rooms at all. And there is one non-infected, one or two people in the rooms who are also within that, confined to the room, and they were infected also. So the question of it traveling some distance and infecting the people is not yet settled, but and so it may be, and that's my thought, it may be more airborne than the previous Delta variant. If this is so, we have to be extremely cautious because, and as rightly said by Dr. Rahul and Dr. Shushmita, that the only thing which comes between this virus and your nose and lungs will be your mask, and your then subsequently your immunity. So these are the only two things. So high transmissibility is a real possibility, and airborne transmitted is also a real possibility.
Thank you, Dr. Rahul. There's another thing is that now we have a significant proportion of our population who are still not vaccinated, and these are the younger age group, below 18. As Dr. Shushmita was rightly mentioned, now we have started sending our children to school. So there's a lot of concern among parents. A lot of parents, both parents are working, and so that concern that is there. So So at the workplace, they need to work with that comfort that their children are safe. They can work at peace and not get distracted about these thought processes. So, what is your take on this?
Yes, sir. So there is a vulnerable population, and this vulnerable population is not because that we know, just like Mr. Sir said, that there is a possibility that this may be more transmissible. There's also a thought process that is there a vaccine immune escape which is seen. That's one aspect. The second aspect is the vulnerable population, and third aspect is the pediatric population. So I think the data on vaccine immunity and escape is not very clear, sir, and there is absolutely no scientific data on that. We are just basing that assumption on the mutation which is there, on the spike protein, which is where most of the vaccines act. So I think we should not fall into that. Vaccines work. The vulnerable population is the population where antibody levels may not have picked up at all, which is the population with maybe malignancy, who are on immunosuppressive therapy, patients who may have immune deficiency syndromes, those kind of people, and that population is certainly vulnerable. And then there is a pediatric age group which is below 18 right now, where vaccination program has not yet started. So I think parents, first of all, children between 12 and 18 or 10 and 18 can be reasonably taught to wear a mask. I think schools and states need to have good, solid protocols in place so that they can make the school environment safe. So I can talk about Maharashtra. Maharashtra government has got a pediatric task force which has actually initiated protocols for how public and private schools both, because it needs to be a uniform policy. You can't have a separate policy for public schools, separate for private schools. It's a uniform policy which has been made, which has been sort of given out. Some simple things which can be done is you could have staggered timings for school. You could have less attendance, maybe only 50% attendance on each day, and then you can rotate the children so that there is not too much of crowding. Lunch, rather than having indoor, you can have an outdoor lunch space where it's all open air, so that children tend to eat with each other, and at least that much of transmission could go down. These kind of things should be done. Most importantly, the staff, the teaching as well as non-teaching staff in the school has to be vaccinated completely. There is no second doubt about that. For children who are below 12 years of age, and everybody else, I think as parents, we need to sort of set an example and be their role models, so that when they see us wearing a mask, when they see us saying that mask is important, and not the expression that I'm fed up of this mask and we remove the mask and throw it away and say, when am I going to get rid of this mask? That kind of expression is a dangerous expression, because children will follow that. So a positive expression, a positive note about mask, how it is helping us, how it is saving us, is very, very important. And as and when the government decides on the policy for vaccination for children, which I think is due very shortly. It may be a matter of few weeks, maybe a month or so, but there is increasing amount of evidence coming that it will have to be started up shortly, and we just don't know the exact reasons why it has been taking time to roll out. And I'm sure there are good, valid reasons, and we should have confidence on our entity, which is sort of taking time to roll out this program, because there may be so many issues which are not we are not privy to the information, which they might be wanting to clarify before they started. But it should be coming up very soon, and if it comes up, all of us without any hesitation should go and get our children vaccinated. I think that's the one. So I think parents, rest assured, schools are safe as long as the protocols are followed, and most schools are extra vigilant. I have now attended at least 5 or 7 school webinars where I was invited, and I can assure you, public as well as private schools are extra vigilant, because they understand that they carry an extra responsibility on their shoulder of looking after your kids. And we all know, all of us love our kids more than ourselves. So that responsibility that the teachers and people are aware of, they want to shoulder it in the right way. Please send them to the school as per your state policy.
Thank you, Dr. Hall. This is very important and very reassuring to the parents, I think so. It's a very important take home message, because number one, they have to be the role models. And these 2 years has been actually a sort of a curse to the children. If you can look at it, the development has been impacted. and how many of the children, what I say call Bharat, outside the metros, are have access to proper internet facilities, look going to the small phones and doing their online studies. It is horrendous. So I think so the development of the children has been impacted. So this reassurance of sending your children to school will go a long way. We can't get back those 2 years, but moving forward, I think so is a very positive step. Thank you. Now coming to Dr. Shushmita, I think so something very important is that we don't want to press the panic button, because sometimes what happens, give credit to the print and electronic media. They have highlighted about COVID, what to do, what not to do. But sometimes with so much of information, what we called a deluge of information to everyone, uh, uh, people tend to get panicky. So we have to ensure that we don't press the panic button. We don't overwhelm our hospitals, the infrastructure that exists, because not everyone needs to go to a hospital. So, what is your advice, and sort of so that the audience who are viewing this can be assured they can take home some message, they can spread this message amongst the friends and family and in the community. It's a very important thing to take home.
Yeah, Dr. Panigrahi, that's a very important question. I think throughout this entire pandemic, panic has played a major, major role in a lot of hoarding, in a lot of, tensions and lots of psychiatric manifestations, which are bigger than probably the infection itself. From the very beginning, gradually, it did dawn on everyone that only 10 to 20% of people who get COVID infection actually need hospitalization. Most recover at home. Having said that, we also need to remember that these are winters and almost all viral infections have more or less the same symptoms. It's not necessary that everyone will end up having COVID. So, a few things that need to be taken care of are that if you are having any symptoms which are viral, such as a runny nose, a headache, a fever, or a sore throat, the first thing to do is isolate yourself. You don't want anyone else in your family getting the infection. So you isolate yourself, and if your symptoms persist for 72 hours or more, you wear a mask obviously during this period while you're isolating. 72 hours later, get a test done and get your RT-PCR done from a proper laboratory. Try not to do home tests. Lots of times they can turn negative. So get an RT-PCR done, and if you are positive, even then there is no reason to panic. There are few things you need to monitor. You don't need many medications because most viral infections, including COVID, are self-limiting. They don't need antibiotics. Everyone does not need antibiotic. Get in touch with your doctor, whoever they are, and most doctors throughout the pandemic have been very helpful, even over the telephone. So get in touch with them, hydrate yourself well, take paracetamol if necessary, and definitely make sure that you have a pulse oximeter available at home and check your oxygen levels. If your oxygen saturation levels are 95% or more, you don't need to worry at all. So while resting, check your oxygen levels and do a little bit of walk, about 3 minutes to 6 minutes, and see if your oxygen levels are falling or not. If they are okay, even if you have COVID, you have mild COVID, there is nothing to worry. Consult your doctor. They will give you some medications to keep you comfortable at home and continue monitoring your oxygen levels. If you have other illnesses, if you are elderly, then you need to contact your doctor to see whether you need hospitalization or not. Maximum people will not need hospitalization. There is no concern or panic at all if you have COVID in the very beginning. It's only if the symptoms are developing that is when measures need to be taken, and they should be taken in time. The problem happens when people get overcomplacent, because with COVID infection, sometimes people do not get any breathlessness. The only thing that will tell you that COVID is progressing is your oxygen saturation levels. So if your fever is persisting and your oxygen saturation levels are dropping, please don't wait for them to drop below 94. If they're going 94 or below, immediately go and visit the emergency of your nearest hospital or consult your doctor. They will advise you what to do. So most people in about 7 to 10 days time will start to recover. and won't need hospitalization as long as their oxygen levels are okay. So, monitoring your oxygen levels, eating and drinking well throughout the infective period is very important to bounce back early and remain active within the isolated room that you are in, which you are at home. And that should see you through.
Thank you. So the message is not to overwhelm the hospital infrastructure, because whether it's the public sector or private sector, because in the last two waves, especially the second wave, we all across the country this happened. So this is a very important message. Thank you, Dr. Shushmita. Just to share some good news is that yesterday it was just by chance. We got into all the panelists that are here. Myself, there was other doctors from Fortis and outside Fortis also. There's something called the WHO Global Clinical Networking, based on for this COVID. So they had it was driven from Geneva. There were people from USA, the other parts of Europe, from India. We were there. Inside Fortis, outside Fortis. They're from Singapore. And the most important thing is that there were doctors from South Africa, where this happened, who reported, who had the gumption, the guts, and the conviction to quickly do genuine isolation and declare to the world that this is a new variant, which sort of encouraged the community at large to quickly take action on what to do, what not to do. And we heard from them. So, on that count, I would like to request Dr. Anup Mishra to give his thoughts about what transpired yesterday, because there were significant take-home messages there, which I think so it's pertinent for us to share with our fellow citizens.
Thank you, sir. Thank you. And I was very fortunate to be part of this networking meeting along with Rahul and Sushmita. And there were two people who presented the data. One was a public health specialist, and other was a frontline clinician. And they presented the basic information that they have got uh, in during last 1 month, and they compared the data of last 1 month to the previous month, waves and previous months. Uh, and I must say this is the first time that we have got a solid data, because previously we were talking on hearsay. Somebody there said that it is mild, we are saying mild. Somebody said it is increasing, we say increasing. But yesterday we saw the charts and graphs and we believe them, and the data are like that. And I'll just very briefly summarize the data. That the current wave, and I told you earlier, the current wave is going faster than the earlier two waves in the particular province that they have shown the data. And it is very fast, and so meaning thereby that this infection is spreading very fast. Uh, the second thing, important thing that they showed was that while the COVID wave was going like this, the death rate was not so high at all. Unlike the previous waves, two waves, where death wave also was, there was a bump. So the wave was like this, and there was a bump in the death rate. Here, the wave is like this, and the death rate is not, there's no bump in the death rate. So that's very, very reassuring. The third thing is that the doctor who took rounds and was treating the COVID patient said that most of the patients who are admitted in the hospital are actually not because they had some symptom of COVID, because they're admitted for surgery, they were admitted for something else, and then they were tested and found to have this. So large number of people did not have much of a symptom or mild symptoms, and very few people had severe symptoms. In fact, you can count them on the fingertips, and very few people needed oxygen or respiratory support. And as I've told you, the death rate was very low. So the worrying part is large number of people are infected. Not worrying and very reassuring is that serious people are not there after the infection. The second part that they showed was that which age group it was infecting. And very interestingly, unlike the previous waves, the age group which was being infected was 40s and 50s, which is relatively younger age group. And in fact, very interestingly, in the elderly age group, it is less. The infection was also less, and the mortality was also less, which I was surprised, and I would like to see further data, of course. Uh, so so. This is something important to remember, that if it strikes and if this pattern continues, then the younger ages may be infected. The third thing that they showed was that less than 2 years children are getting infected. Now that's something very worrisome, and especially from India point of view, because less than 2 years anyway, the vaccination may not be feasible, but children as such, they should be vaccinated. So that was the gist of their presentation. But what today has emerged from South Africa, and I will add that to the story, is another worrying trend, and that was a small study, very small study, where for people who have been given Pfizer vaccine 2 doses, and their antibodies were isolated, and then tested against the various variant, and found that antibody has major loss of effectivity against Omicron. Now, remember, two things. This is very small study. Number two, the antibody is the only one part of immunity, and there are other parts of immunity also. So this may not reflect in the real, but but all the same, this is something which has been widely shared by media today. And if you see CNN or New York Times or everything is front, this is the study which has been shared. And Anurag Agrawal from CSIR, our frontline man as far as COVID testing, genomic testing is concerned, has also tweeted that it is a matter of concern.
Thank you, Dr. Anup. In fact, that's very reassuring, and I think so. One thing which he also mentioned, that doctor in the ICU, the eight patients, 9 patients admitted, out of them eight were adults and one was a kid, and all the 8 adults were not vaccinated. So it's a very
Absolutely.
significant information. And the younger age group, it could be, I'm just extrapolating, is that getting affected. The elderly probably have been vaccinated. The younger people, they think that they're Rambo or Superman, so they have not taken it. So they are the risk to the children. So I think so. This is another
Absolutely.
take-home message. I don't want to. Time will tell and decide on this. But this could be one of the things. So message is that please get yourself vaccinated. So it's a very important thing going forward. Dr. Rahul, I think so. Another thing is that uh, continuing on this, what are the precautions that we need to continue adhere to? Because I think so we need to reiterate this. It may be repetitive, but I think so it's important to sort of push the message. So I want to ask you again.
Yes, sir. Absolutely. I think what I have been saying to everyone, whether it's a webinar or a news channel or wherever I am talking or giving or we are having a discussion of COVID, is that we have to have a vaccine plus approach right now. The vaccination, absolutely, everybody needs to get vaccinated. 2 doses need to be completed as quickly as possible. And if you are now eligible for a booster or an additional dose, whenever the policy comes in, please go and do that. So that's the vaccine part. The plus part is the masking, social distancing, and some social responsibility. So masking, I think what is important to masking is to wear the mask correctly. So one mask is certainly not sufficient. When you wear a mask, you need to have your nose, middle of the nose, to the lower end of the chin covered. I think that's where the mask has to fit, not on the chin, not on the neck. It has to sort of cover up your nostrils as well as your mouth. Second is, preferably, this is the time to actually completely adhere to double masking. When the common man steps out of the house, you can wear a cloth mask, and along with that cloth mask, there is a 1 rupee surgical mask, 3-ply surgical mask available, 2 rupees 3-ply surgical mask available. Please wear that as well. Double mask gives you better protection. How does it give you better protection? Not just because there are a number of layers in between the atmosphere and your nose, but it also plugs the gaps which a single mask may have on your face. So the double mask sort of helps to plug up those gaps and thereby gives you better protection. for all frontline workers, which include healthcare workers, people who interact on a day-to-day basis with a large amount of population which comes to them. Maybe people who are bank employees, for example, policemen, for example, they all should wear a N95 mask. There is no two ways about that. I think people who are at a high risk job need to wear an N95 mask. And then comes our social distancing. Now it's very difficult. Nobody is asking you to disrupt your day-to-day life and stop traveling by train or buses, because that's your livelihood. You will still need to go to work. But if you adhere to your mask well, I think traveling in a train or traveling in a local train in Mumbai may be inevitable. You will have to just do that. But going to a congregation of people which is optional is certainly in our hands. So we should not try and do that, especially in functions where food is served. Because the moment you go there, you remove your mask for the food, and you are exposed then to a population which is surrounding you. You know, you have to step out of the house thinking that apart from your 4 or 5 family members who stay with you, everyone else could be potentially COVID positive. Once we go out with that attitude, only then the mask will stay on with you. And then the social responsibility. Social responsibility is that I will stay protected. I will keep my loved ones and friends protected by vaccinating myself and getting their vaccination done. But I would also keep a vigil on somebody else who may be exposed, and I would request that person to report to the appropriate authority. I think this is the time to actually have a little bit of social responsibility. We need to think out of the box. If we know somebody has visited from outside and is been asked to home quarantine, but you see them roaming around in your society, in your locality, I think it's time to bring it to the social notice, because one correct action from us will save our country from going into stricter measures which may not be healthy for our economy. So I think we need to be socially responsible. It's not about whistleblowing, it's about being socially responsible. Thank you, sir.
Thank you, Rahul. A very relevant message, socially responsible, masking. And the very important thing is that if your neighbor's house is in fire, your house will be in fire. So I think so that's a very important take. So we must be an active member of society without being disruptive. Uh, Now coming to the something that is in everyone's mind and doing the rounds. Dr. Shushmita is on the booster dose. So there's a lot of talk going about this. So what is your take on the booster dose?
Yeah, it is at the moment quite on the hot seat, I would say, with regards to whether to be given, when to be given, etc. So what we definitely know is that following two vaccinations in healthy adults, you have a robust immune system which is good enough to tackle any virus. But in those who are immunocompromised and in those who are being faced with high levels of virus on a daily basis, such as healthcare workers and frontline workers, over a period of time. So our immunity is twofold. One is with antibodies, and the other one is with T cells. So the neutralizing antibody levels gradually reduce as time goes on. So my own take is that in those who are faced with high levels of viral loads, and in those who have compromised immune systems, these are people who should be given boosters and should be definitely given boosters if it is beyond 9 months or so, as evidence has so far. This is still an ongoing process. The science is still developing, and we really don't know what is the right time to be given a booster dose. But what has been shown so far is that beyond 9 to 10 months, the neutralizing antibody levels definitely start waning. And I personally think that those who are in the front line, those who are facing high viral loads, and those who are immunocompromised should be definitely offered boosters if they are beyond that period of time. It can change, it can differ from person to person, but as we know that in the West and in Europe, these are things that have been accepted and have been offered even to people who are not immunocompromised beyond the 9 month duration. And I think that is something that should be definitely thought about and worked. And I know that our scientific community in our country is working overtime to try and see how that can be done.
Thank you, Sushmita. Rahul, I have a very important thing is that before the Omicron came in, we are towards the end of the year. A lot of people have have planned for their year-end travels. If you look at it, a lot of the hotels are completely booked. You don't get bookings now, the main tourist locations. So, what are the things that we need to be cognizant of, take precautions, and what is the message that because the hotel industry, the service industry is a very important employment generator that took a huge beating in both the waves. So, without that getting impacted, what is the advice that we need to give to the families and the to industry at large?
So previously, maybe before COVID, I'm saying, we used to very routinely say safe flight, safe holiday. We actually now mean to implement that safety in its true spirit and letter. We need to really understand what safe holiday is. So we all need to go for a holiday. I'm not denying that. I'm not saying please don't go on a holiday. I think holiday is necessary. People need to step out of the house and go and have some quality time outside their normal routine, because they have been, there is a significant amount of pandemic fatigue which has gone in, and that needs to be addressed as well. Otherwise mental health will also become an issue, which already may have become in some of them. But how to do it safely? So if you're traveling by whatever mode of transport you are traveling by, whether it's flight or train or bus, again, keep up with your mask. Do not eat as far as possible in those crowded places. If you are eating, tie up with the person next to you and say, you finish eating, wear a mask, then I will open up my mask. You've got to be a little bit more innovative, because you will have to still travel. When you go to a hotel or a restaurant, insist on having a place which will be a little bit away from other people, or if you can order for room service and eat in your room, that will be better. These are small things. If you do have to remove your mask in a public space to eat, it's compulsory because there is no other option, you are stuck there, then go find an open air space and maybe you can have a quick bite in the open air space, less likely to be infected. And most importantly, keep yourself in a bubble where everybody who is immediately surrounding you is vaccinated and adhering to the COVID appropriate behavior. I think these are the small travel tips which I would like to give. I'm not against travel. I think the economy is one part. Mentally, everybody needs to step out and go out. But that doesn't mean that you go and attend a big function where thousands of people are coming and you are removing your mask. I think that kind of a behavior needs to be toned down. Optional things need to be toned down. Weddings will take place. Choose up your spot if you're going for a wedding. You need to wish the family people who for whose wedding you are going. But when you're eating food, either avoid or go in a corner and eat, so that you're not mixing with too many people. I think this kind of a behavior needs to be done everywhere. It's a matter of few months, maybe more than that, nobody knows for sure. But again, that social responsibility thing which I was saying, sir, comes into the play. So enjoy and have really safe travel this time. So don't stop yourself from traveling, but travel safely.
Thank you, Rahul. Dr. Anup, this is a very important thing because it's concerning a lot of people. It's across the country. Is that with this new variant coming in, do our treatment protocols remain the same? Because this is what we have at present, and because that is a comfort that the public at large will can have if they feel that what exists is okay, because this is the way to sort of reassure people. So I'd like to just take your opinion and uh, what are your thoughts on this?
So very important question, and there are large part of knowledge which is still to be acquired in the future research. So there are three types of treatment. One is against the virus. So there are some drugs which are acting against the virus, and that we use them. The second is against the inflammation, against the cytokine surge, and reparative treatment, etc. etc. So those are not against the virus. And third, a physical treatment, which is either the oxygen or the respiratory support. So let's go back and say third treatment remains the same regardless of any variant ever. So our oxygenation policy, our physical therapy during that time policy our intubation policy, our respiratory support policy, our fluid support policy, all will remain same as for treatment of the previously. We have shown that these things work against the severely infected people and against when the lung damage is severe. So that remains. So there is no question about it. The second thing is that drugs, something, either a mild drug like colchicine or more definitive drug like steroids, they will also remain the same because they have been proven to decrease either cytokine storm or inflammation, and any virus or any bacteria will produce it, and we will have to use it as and when required. So there is not going to be any change. And we've heard in the South Africa presentation also that there's the only treatment for serious disease is steroid. So in serious problems, or when, as Dr. Shushmita has said, the oxygenation level goes down, steroid is the best, strongest, surest treatment. Now the third thing comes, and which is something which is coming up fast. New drugs are coming up, and so on. And previously used drugs have been thrown out. Let's see. There are a couple of drugs, new drugs. One is molnupiravir, which is again an antiviral drug, and other is Paxlovid, which is another antiviral drug. And in the in the usual COVID scenario, they have been working to a varying degree, of course. Some are working to prevent death, and some are working to prevent severity and need for respiratory support, and so on. But uh, as yet, nobody can say that these will work in the same manner against the COVID variant. There's another very very important question which has arisen while using molnupiravir is that whether it may cause death of the simple COVID-19 and there is survival of mutants. And this question has been raised by many people against this drug and maybe for other drugs also. So mutants may rise once you're killing the easily, susceptible population. So these are some of the questions which I have no answer, and nobody has any answer in the world. And new drugs will are welcome. They are, for example, the third one which I've never discussed, and that's the Rahul's domain, is the antibody cocktail. Whether it will work in the same manner against this or not. So with the hope that it will work, we will continue to use them as and when they become available, or they are already available. But we have enough treatment support for the sick patients. Steroid, oxygen, respiratory support will continue to be given, and many patients will continue to be saved.
Dr. Rahul, I just take off from that antibody cocktail. So, if at least many of the audience will not be aware of it, they would have heard it. So, if you could just speak a few things about antibody cocktail.
Sure. So there is an antibody cocktail which is available in India currently, which has been in the market since June this year. It's a combination of two antibodies, casirivimab and indivimab. It is a mixture of the drug which comes across, and the idea is that these antibodies actually go and bind onto the receptor binding domain of the virus, thereby almost having a definitive cure for the virus, the viral disease, because it does not allow the virus to bind too much to our cells, and thereby helps us in getting better very quickly. So these antibodies, obviously, like any other antibody treatment, any antidote which needs to be given as early as possible. So if you can give it on day one, the effect is the best. But the approval has come for up to day 10 to be given. But there is a caveat there: if the patient's lungs are already involved and oxygen is required, then maybe the antibody should not be given, because the dose required for oxygen therapy patients is a bit higher. There is a different study which was done for that. Now, the problem lies here that because it acts on the very receptor domain where this Omicron has mutated extensively, more than 32 mutations at that domain site, whether the monoclonal antibody cocktail will have the same amount of effect on the new variant or not is a big question. And like all other unanswered questions, this is an unanswered question as well. Yesterday, we talked about this in the WHO seminar with the South African doctors. One of the American doctors actually spoke about the action for monoclonal antibody. Unfortunately, it's not been used in South Africa, so they don't know. So I think we will have to wait for the companies to give us an understanding and scientists to give us an understanding whether indeed we need to be cautious when giving this, knowing that it may not act or it may partially act. My feeling is that it will probably have some effect, not as good as the other ones, but these are just feelings, sir. Feelings carry no value. We need to have solid hard paper evidence in public domain to make any conclusive statement. So right now I would say that while we are having delta variant as our predominant variant, we know for sure that it works. So if somebody who is offered this monoclonal antibody treatment by their doctor, they should definitely consider it. Why I'm saying consider it? Because there's a cost implication to it as well. Right now, it's a very expensive drug. For an average Indian, it may not be something which would be possible to be afforded. One dose is for 60,000 rupees. So unfortunately, it's not something which can be a part of a national program right now. But certainly, those who can think of it and those who are offered this, and they are in the early phase of the disease, it can be taken.
Thank you, Rahul. I'll come to the 12th question, which is the dirty dozen question, which I'll answer before we open it up for questions. So let me take the dirty dozen question. Is that in case there is a steep rise in cases, are the hospitals well prepared to handle the surge? So this much reassurance we can give to the public is that hospitals are well prepared. All the COVID precautions that were taken during the first and especially the second wave at the emergencies, at the OPDs, they are being adhered to. When any patient comes into the emergency, they are screened properly. There's a area which is kept as the suspect area until they are screened and identified as negative. Then they are admitted in the normal areas. They are found positive, obviously they go to the COVID areas. Similarly, in the OPDs, the social distancing, masking, all those things are in place. We would have heard about the panic that happened with oxygen. Most of the hospitals have now started having their additional plants called the PSA, where they have the oxygen, the manufacturing happens in the campus itself. So our hospitals have already, most of our hospitals in Delhi NCR have started, it has been installed. Some of them are in the process of being installed. The other healthcare organizations also have done it. So oxygen, which was a huge talking point in the second wave, that is not there. And as our panelists rightly mentioned, the standard modes of treatment have been identified, where to give steroids, how long to give. In fact, that when we heard about all the mucor and all that, if you recollect, it was an overdue of steroids and overuse of steroids. And the panelists that you're looking at, they had prepared something which we implemented across our organization, which is part of our sort of a Bible, if I can call it, about when to use steroids, how to use it, how long we use it. So this is the assurance that we would like to give to the public, is that hospitals are prepared. Hopefully, we'll not have a surge in the way that we had in the second wave, but we are prepared, and be rest assured, and do not press the panic button. And now over to any questions that are there. We'd like to, if you have something in common, you send it. If you have anyone in particular who would like to answer, if you say, we'll put it up to the panelists concerned.
One more addition to, sir, what you said was that we are also prepared for pediatric patients, and you were heading that committee where we prepared the whole protocol for pediatric patients. So we are prepared for that also.
And in fact, just being part of the FICCI COVID expert group also, the pediatric guidelines that were prepared by our panelists here and some other pediatric colleagues also, that has been incorporated into the FICCI guidelines for COVID, and Government of India has also taken that up. So I think so. This is where I think so. The public sector, private sector, there's nothing like that now. So there is a lot of cohabitation happening, a lot of cooperation happening, interplay of knowledge. There's so that I think that there's one. As I say, in adversities, opportunities come up. So there was a lot of sort of mistrust, I can put it this way, against the private sector. I'll admit it. But this COVID pandemic has definitely shown that the private sector has a role to play. We will play. We are part of the same society. We are the same fraternity.
Well said.
Absolutely, sir.
No questions?
So there are questions. I can see them in the chat box. If you want, I
I
can
can go
I
ahead.
can ask the other two panelists. I can take up your job for 5 minutes if that's okay.
Go ahead, please. Over to you.
Thank you, sir. So yeah, one question is already been displayed by. It's a question asked by Dr. Manish Dubey. Can we send our children to school before COVID vaccination? Sushmita, would you like to take this question?
Yeah, sure. I think
Partially been answered.
said you've said a lot about already, and I think yes, without a shadow of a doubt, children need to go and have a normal life, but it has to be a new normal. Like as you said, that we can are able to ensure that the children are masking properly. They understand the value of social distancing. If the schools, the people looking after them are all fully vaccinated, if the children are not, and the staff is fully vaccinated, and if they are adhering to protocols which are COVID appropriate in school, if we are able to ensure that, definitely the children should be sent to school.
There's another question by Mr. Arshad Khan. Mr. Khan is, sir, Anup Mishra, sir, this would be for you. He has taken the first dose on 14th February and he's missed the second dose. He's asking, can he take it after 10 months? What would be your advice for him?
See, this is not the ideal situation. Ideal situation, I don't know what vaccine you've received, but ideal situation is either 1 month or 3 months after the first vaccination that you should receive the second dose. However, whatever benefit it may have, it may, if you after first vaccination, your antibody levels may not be as high as would be after the second vaccination. Uh, they're already waning. There is I feel that there is no harm in taking the second dose if you have no problems with the first dose. And if you take second dose, then at least you will have some escalation of your antibody. So highly unusual situation, not the usual one. However, if we have to innovate, this is the answer I would give it to for you. Go for the second dose, and then observe all COVID appropriate behavior at least for 4 to 6 weeks, because your antibody levels are already down, and the second dose will take that much of time for generation of the antibody.
The next question is by,
Can
thank you,
I
sir.
just add one thing?
Yes, yes, of course.
Can I? So there's too many patients that are coming to OPDs, even in cities like Kolkata and in metros, who are all partially vaccinated, or have had something else to do and not taken their vaccination. Omicron or any other variant that comes, the only thing that we have right now to fight is the vaccine. And I think, as Dr. Mishra said, even if you are partially vaccinated, please go ahead and take whatever vaccine is available to you as soon as possible, because some protection is always better than none.
Absolutely. Absolutely. The next question I'm going to keep open. Either of you can decide to take it. Niranjani Madaliji is asking, does immunity alone finally plays a major role, whether it's Omicron or any other COVID variant? So is immunity the only thing? I think we've answered partially that other things like masking and everything also plays a role. But anybody who wants to take it, either of you, sir.
Well, if you say the body's defenses against any microbe, whether it's a bacteria or whether it's a virus, the final common pathway is the immunity, whether it's combination of humoral, which is the antibody, and the cellular immunity. Uh, and in general, your own fitness, blood circulation, your your internal organs working well, not damaged, and all this will be controlled by your excellent nutrition, your previous exercise, and if you have a comorbid condition, then control of a comorbid condition, for example, say, let's say diabetes, a very good control of diabetes, a blood pressure, good control of blood pressure, and if you have a heart disease, at least you should be taking all the medication. If your internal system is working well, your organs are working well, your nutrition is good, you're doing daily exercise, your humoral immunity and T cell immunity, both against the microbe, will be working well. So this is the overall sequence. So it's not just that your immunity will work, everybody's immunity will work the same way. It's never that.
I think, sir, thank you, sir. The rest of the questions are essentially around the booster dose, which I think we have already addressed in our discussion. Unless anybody wants to add for booster dose anything else, but back to you, Vishnu, sir.
So, to summarize, I think I'd like to thank all the panelists for an excellent talk, and your suggestions are very pertinent. I think so. It goes down to all the people who are heard it. I requested that you'll spread this message, and some take-home points. I think so. Masking is that we all of us have to now wear, and as Dr. Rahul rightly mentioned, above the nose and fully covered, and those in frontline double masking, following the COVID appropriate behavior. And Dr. Anup, I like to, and Rahul, both of them, this something about the, I'm setting the cat among the pigeons. I may be, when I'm jumping the gun, we are having a humongous amount of data now over the last 2 years. And since 16 January, our vaccination started. We are only giving vector-borne vaccines, not the mRNA vaccines. So how good this is vis-a-vis the mRNA once this data is captured, and that obviously a independent body should. I understand we are small fry in front of the big pharma lobbies, but holistically speaking, this is something that we need to take up with the health ministry, with the health administrators, with our scientific community in India, because we are proud Indians. Let us be proud of ourselves. I think so. There's something that I mean, a thought has come to me. I may be wrong of the mark, but I think so. There's something that we should look at, because as doctors, as scientists, we have to be inquisitive. We have to look at the next frontier. With that, I think so. I'll thank each one of you all. Thank you. Namaskar.
Thank you, sir.
Thank you, sir.
Thank you. Thank you.
Band kar.